Welcome to the Ethnomed podcast, a community voice in the clinic. My name is Dr. Duncan Reed, a physician in the International Medicine Clinic at Harborview Medical Center and medical director of Ethnomed, a web resource for providers and patients with information for cross-cultural care. Today, we are continuing our interview series called Provider Pulse, where we elevate diverse voices from across healthcare fields to learn the paths people took to their current roles in healthcare and how their cross-cultural experiences have helped them provide more informed care to a diverse patient population. Whether you are an undergraduate student considering a career in healthcare, a practicing health professional, or a member of the community, these conversations are for you.
I had one sister who is younger than me, but she passed due to diarrheal disease, malnutrition, dehydration. And I still remember the pain we felt in our family and how someone can pass from that preventable disease and still a big issue in Africa. My first time applying for residency, it was 2019. I applied 100 program and I got 0 interview. I was shocked. I felt disappointed and I said, what I'm missing. So they always tell me, you are at United States, the land of freedom. If you cannot succeed in USA, you will never gonna succeed anywhere else in the world.
On today's episode, we speak with Dr. Abdifitah Mohamed, an internal medicine resident at the University of Washington in Seattle. Dr. Mohamed shares his remarkable journey from being a top student in Somalia to pursuing medical school in Sudan. He reflects on the significant challenges he faced as an international medical graduate applying for residency in the United States, as well as the profound sacrifices made by him and his family along the way. This episode includes a number of acronyms. I will include descriptions of these in the show description.
My name is Abdifitah Mohamed. I'm originally from Somalia, where I grew up, and I did my medical school in Sudan. And I did 1 transitional year of residency in New Jersey at Hackensack Palisade Medical Center. And now I'm doing my residency internal medicine here at the University of Washington. I was born in a city called Berbera, and that's the north side of Somalia. But I grew up in the capital city, Mogadishu. My father passed away when I was only 3 years. So I grew up with my mother. She was the backbone of our family. She was working double jobs. She was doing a lot of hard work in order for us to succeed in the life.
Where did you do your schooling?
So I did my primary school in Somalia, Mogadishu. Also, I did my secondary school in Somalia, where I was number 2 in the whole school. So with that, I ended up getting a scholarship all over the world. I was getting a scholarship from Pakistan, from Sudan, from Yemen, and I was more interested in doing medicine and helping underserved communities. So I ended up going to medical school in Sudan, 2003.
Do you have any siblings?
I have one brother who is older than me, and I had one sister who is younger than me, but she passed due to diarrheal disease, malnutrition, dehydration. And I still remember the pain we felt in our family and how someone can pass from that preventable disease and still a big issue in Africa. So that's one thing that I will end up doing medicine in order to help my community, my people.
I'm so sorry. How old were you when that happened?
I was young, I will say 11 to 12 at that time, and I can see my mother didn't know what to do, and there was not enough providers in our city. We were living outside of capital city of Mogadishu in a small village, and we were having a hard time even to find any health professional or any resources of treatment like oral dehydration solution. Even we couldn't able to find in order to prevent the dehydration. I realized how much it is very important to have health professional as well as resources.
How old was she?
She was young, I will say maybe 3, 4 at that time when she passed away. Yep.
Well, I'm so sorry. It sounds like you're always an exceptional student, always working very, very hard,
Absolutely.
always stand out.
Yep, in my primary school, I was like number one. In my middle school, I was number one. In my high school, I got number two because there was someone else who were like more brighter than me. And I always love, mathematics. I always love physics, biology. When it comes to memorization, I was like number one. Even in our community in Somalia, there is a competition about who can memorize the book of Quran. So I was number one. Even one time I went all the way to Saudi Arabia to participate in a competition about the memorization of Quran. And that also was published in a website that still have my small picture down there.
So it sounds like you're incredibly gifted, but you're always working very hard. How was other parts of your childhood growing up? Did you have lots of friends, and how do you remember that time?
I grew up in a village outside of Mogadishu, and the people that I left, we had like very close-knit friends. We go together to primary school. With the same friends, I went with them to the middle school as well as secondary school. And with the same friends, we used to go to the Islamic studies together. And up to today, we still have that kind of connection. We communicate through Facebook, we communicate through WhatsApp group. So that connection is still on.
And are they still back in Somalia?
The majority of them, yes. Some of them, they left Somalia, they're working in Kenya. Some of them, they are in Middle East, working in Saudi Arabia, in Egypt. Some of them are in Europe. And one friend, he lives in Phoenix, Arizona.
Wow, so everyone went everywhere.
Yes, yes.
How was it being a great student in Somalia? Did people give you a hard time? Is it something that you were teased about, or is it something that you can be proud of and people will respect it?
I think, the last one, people will respect, will appreciate your effort. And I was so lucky I had this kind of talent of memorization. It was easier for me, and I was working very hard to maintain that kind of level of memorization practicing most of my time. My mom was doing a lot of work for me, and she helps me even paying private tuition to go to learn English in the afternoon after I come from school. Also, I go to mathematics class. So I was doing extra classes after I came back from the school in order to maintain that kind of high score always.
So it sounds like your mother is just this incredible person.
Absolutely, absolutely.
Working 2 jobs and then also making sure that you're not only going to school, but you're getting supplementary education that she's paying out of pocket for.
Yep. That was our lifestyle back home. So absolutely.
And it sounds like you were already thinking about medicine when you were in secondary school?
Yep, I was thinking doing medicine as my first year in high school, and how it is important to have a health professional in our local community, and the importance of having a doctor, whether it is a surgeon, whether it is pediatric, whether it is OBGYN. At that time, I was not more interested in medicine or cardiology, but my goal was pediatrician, surgery, and OBGYN.
So you're already thinking about family at that time and about your community. And it sounds like the fact that you're still staying in touch with your community members from Somalia means a lot, that you're very close-knit.
Absolutely. I visited Somalia last year, late November and December, and I was there for 2 weeks. I was spending every day with my family, with my friends. I haven't been in touch with them maybe more than 10 years. So this was the first time I was there in person, meeting with my old classmates, meeting with my teachers, meeting with the community down there, and making sure that I'm still available for consultation. I'm still available for help, whatever I can add or contribute to the community.
How was it seeing all those people after so long?
It was amazing and I couldn't even believe it. Sometimes maybe the pictures is not telling the whole history, although I can see their pictures on Facebook, but that's not tells you the whole history. So going back there in Somalia was life-changing for me. I have seen the city is totally changed. The architecture changed a lot. The security in Somalia now it's improving a lot. People can stay awake or stay late night, maybe 1 a.m., 2 a.m. There are some restaurants are open right now, even at 2 a.m. in Somalia, which is incredible and beyond my imagination. If you ask me the same question 10 years ago.
Did it feel like home?
A lot. Even meeting with the people and not need to speak English or Arabic language or Swahili. That was amazing. Ordering food with your own native language, that was another feeling.
So taking us back to secondary, it sounds like you're an outstanding student. You won a competition for memorization of the Quran. You had multiple offers for universities, and then you chose Sudan.
Yeah.
And you said that you chose Sudan because you were already thinking about community level thing.
Yep. The other option is I got one of them was engineer, one of them was computer science, because the scholarships are given all around the world to Somalia, to the local and non-profit organization who help and manage and contribute those scholarships. And the government of Sudan stood up with our Somali people, and they used to give us maybe 400, 500 scholarship every year. They are the one who were giving us like engineer, medicine. So, and I want to be a doctor. So that was my option one.
When you accepted that, it was with the understanding that you were going to study medicine.
Yes. I think to clarify people who might listen in this podcast, in USA, once you graduate from high school, you have to go to college, couple years, and then take a test, then go to the medical school, and then you go to the residency. In other part of the world, even in Europe, even in Middle East, in Asia, in Somalia, you can go medical school direct from high school. So you finish your high school. With some countries, they require you have to get a higher percentage in order to be a doctor or engineer. So the people who get above 90%, they end up being a doctor or engineer. So I was like 97% overall of 11 subjects. So that's why I was qualified to get a free scholarship.
And those scores were back in Somalia?
Yep.
Your studies in Sudan, how was that whole experience?
Oh my God. My first year was the toughest one, I can say. Although I was able to understand Arabic language, but the difference was the dialect, the way they speak so fast. And the dialect they speak in Sudan, it was new to me, and that was giving me hard time to reply. So I ended up doing my whole first year as just the introduction to the community, introduction to the school. And the good thing at the university was they understand the challenge we are facing. So they give us more space, they give us more time in order to adapt with the community, with the school. So we were taking easy pathway, I can tell.
And what city were you in?
The city is called Shendi. It is north of Khartoum, around 90 to 100 kilometers. It is about 2 hour, 20-minute bus drive. My school was called Shendi University. It was the only university in that state. So every state in Sudan, they have their own local university. So that was the only university in that state.
And were there many international students as well?
Normally, internationally students, they prefer to stay in the capital city, like Khartoum University, Omdurman University, African International University. Those are localized in the capital city. The people who go outside of the capital city are not a lot when I was doing, but As I was graduating, I have seen a lot of international students from all over the world, from Afghanistan, Pakistan, India, from Yemen, people coming from Jordan, from Egypt, from Kenya, Djibouti. So I can see a lot of international students.
So it sounds like the dialect of the Arabic was a main barrier, but they were nice and they eased you in. How was the rest of your schooling there?
I can tell Sudan people are one of the nicest people you can ever meet. They are very welcoming community. I was living there almost 6 years for my school, 1 year for internship, and I never had any incident or any issue with the local community. They are the best. But for fact, as you know, in our Islam culture, we have a month, we call it Ramadan, when we have to fast the whole day and then we eat after sunset. And I used to remember our neighborhood, they told us we don't have to cook anything. So they will bring us free food and everyone welcoming you to have free food, free drink. And I used to remember that month, I always save my money because I know I'm getting free food, free drink. So they are very welcoming and very humble people, I can tell.
And how was the studies?
The studies, it is a 5-year program. The first 2.5 years, it is called basic. You will learn English as a side, as well as physiology, anatomy, pathology, microbiology. You take the classes, and then you will have your test in order to move to the internship side, which is another 2.5 years. The first 2.5 years, I will say 90% it is in the university. So they are like a big hall, there are attending will come, will do about a presentation, and once you graduate from that 2.5 years, you will move to the next 2.5 years, which is internship, where you go to the hospital and you do 3-month internal medicine, 3-month pediatric, 3-month surgery, 3-month OBGYN. And then there are minorities subject, for example, ENT, radiology, dermatology, public health. After the first 2.5 years, once you finish, you have to sit a big test in order to qualify. And once you do the clinical part, you will sit down for written exam as well as clinical exam in order to graduate.
How was the internship experience for you?
It was amazing because at that time I was able to speak the local language, the dialect. I was able to communicate easy with the patient. I was able to engage, and as I mentioned, the people in Sudan, they don't speak English, and so that means you have to take the history in Arabic language, and when you present into the attending, you have to present as an English. So it is two-side history. So you take the history by Arabic, but you will present as an English, and the whole discussion will be as an English. You will present your history, your family history, social history of the patient, examination, your differential, your assessment and plan in English, and the whole discussion will open with the other teams.
That sounds very challenging.
A lot. And sometimes I was having hard time to take history from the patient because patients, they come in from very rural area, which they speak very tough dialect, which they speak very speed. So people in the capital city, once they see you are like immigrant, they might speak very like basic language in order to facilitate, to make easier for you. But people come from the rural area, they don't have that kind of enlightenment and knowledge. So it was hard time sometimes even to take history.
And then once you took that history, then you would have to translate it into English.
Yep.
Which is also not your native language.
Absolutely.
And present to some other physician who is not a native English speaker either.
Yep. No one is a native speaker English in the whole university. So it was tough. It was a challenge. And we used to study our books from UK system like Comar, Davidson, Harrison sometimes. So it was a very challenging period in my life.
But you finished, and then we're in the US now. How did that happen?
So when I was finishing my university, my class was 130 and I was number 2 in the class. I graduated with higher score, so I did 1 year internship. While I was doing internship in capital city of Sudan, Khartoum, it is a program of 1 year where you do 3 months internal medicine, 3 months pediatric surgery, 3 months, as well as OBGYN 3 months, and then you will finish, then you will get your certificate. So at that time, I prepared to do MRCB because I have seen a lot of my friends, they doing MRCB, they trying to go to UK, Ireland, and I did my first part of MRCB and I passed.
And for our listeners, the MRCP is a postgraduate medical exam in the UK required for specialty training in internal medicine and most other medical specialties.
And I was planning to do MRCB too and move to Edinburgh or Ireland in order to start doing my rotation down there. But having Somali passport, it was always obstacle. It was issue even to get a Europe visa with a Somali passport. And that I felt disappointed that the only issue I have, it was my citizenship that was making for me an issue. So before I finish my rotation in Sudan, I got an offer job from Somalia to work with International Organization for Migration. It's called IOM. It is under United Nations. So I was the medical officer, their office in Somalia, in Mogadishu. So I went back, I started that job, as well as other local job where I was helping the community. In the meantime, I had a relationship with my wife right now. So we communicate through email. That time there was no Snapchat, no Facebook, no Instagram into the... There was Instagram, but there was not common Snapchat or Instagram. So we used to communicate through the emails. And when I was working in Somalia, I realized that I need to upgrade my knowledge. So I applied master's degree for a couple universities, including University of Nairobi, Makerere University in Uganda, University of Istanbul in Turkey. I applied also in Malaysia. I got couple offers, couple acceptance, but I end up again in Nairobi. Number one, it's close to Somalia. It's only 1 hour flight. Number two, we had a large Somali community in Nairobi. That's easier for me even to find a job after I finish. So in 2014, September 1st, I started University of Nairobi Internal Medicine Program. I moved to Kenya. It was private. That means I have to pay fees in order to get training since I am a foreigner. If you are a citizen, you are the one who will get benefit. It's like maybe $400 a month. But since I was a foreigner, I have to pay fees, which was $3,500 a year on top of my monthly spend. So I moved to Kenya and I got married at that time. My wife came down to Nairobi. We were trying to get settled down together, but we realized that it was a lot of difficulties to stay together in Kenya since I was not working full job and I couldn't able to cover all the bills. So she came back to state and applied a visa for me. I came here late 2015, July 7, and it was a summer hot time in SeaTac, Washington.
What happened in the U.S.?
In the U.S., I knew as long as you want to be a doctor, you have to take your USMLE and ECFMG certificate in order for you to qualify. And I had a couple Sudanese friends who live in Chicago who told me the process. In order for you to apply for USMLE through the ECFMG, they have to verify your certificate. That's step number one.
For our listeners, here are descriptions of the two acronyms. ECFMG certificate, provided by the Educational Commission for Foreign Medical Graduates, it certifies international medical graduates so they can enter U.S. residency programs. USMLE, a 3-step examination for physicians to be licensed to practice medicine in the U.S. These will often be referred to simply as Step 1, Step 2, etc.
I sent all my documentation to the ECFMG. They contacted my university. They get my paper back. but there was some issue with the filling out the paper. So we have to send it back to Sudan. My paper take almost 6 months to 1 year in order to get approval for me to register in ECFMG. And after that, I started doing my step 1 in late 2016. Early 2017, I took my step 2, and we had US Milli step 2 clinical skills. It was before COVID-19, and I took it in 2018. My first time applying for residency, it was 2019. After 3.5 years since I arrived to the USA. My first cycle of application, I applied 100 program and I got 0 interview. I was shocked. I felt disappointed. And I said, what I'm missing. Second year, it was 2020. COVID-19 hit the whole country. And at that time, I was doing a lot of behind-the-scene activities. I'm the co-founder of Washington International Medical Graduate here in Seattle. We went to Olympia. We are lobbying, advocating for the IMG's International Medical Graduate to get at least externship here in Washington State. Also to get a limited license, which right now we have. I remember I used to meet with senators, with Congress from my district, as well as Governor Inslee, to just to sell our case and tell them who we are. It was for them new. They did not ever met anyone from the IMG. They never know what is the IMG, what's International Medical Graduate. So we started doing power presentation, doing testimony, doing lobbying with Congress. So I applied again in 2020 and I got 1 or 2 interviews. And one thing I learned from that interview was the program director told me that it's very important to have clinical externship, hand-on clinical experience, as well as step 3. She told me, if you have those 2 today, I will take you. But as much as you don't have, I will never take you. So in 2021, I spent almost 13 to 15,000 of my whole saving to go to New Jersey through an organization called American Clerkship. They charge me $1,000 every week in order to do a rotation hand-on clinical experience in New Jersey. I did that 2 months, which is 8,000 plus my travel, what I was spending. So it ended up 13 to 15,000. I applied internal medicine again. And at that time, I took my step 3. So this time I get couple interviews, including transitional year. And luckily, I got matched to transitional year in Hackensack Palisade Medical Center in New Jersey. And I did 2022 to 2023. And while I was doing, because I have to get a second year residence, I applied again. But this time I get a lot of interviews, including University of Washington, where I get the last day of the interview. It was 2023, January 13th. I remember I met with Dr. Daniel Cabrera. We had a very extensive discussion. I was crying the whole interview. I met with Dr. Sternberg and another attending from Fritz Hudson. I don't recall his name. Fast forward 2 months later, I got an email. You are matched, fully matched. That was my best day. I remember I was crying. I was waiting that email. I was doing a pediatric rotation in a clinic in New Jersey. And even the attendant was keep asking me, what happened? Why you are so nervous today? And I say, it is a match day. Either I will match and I will be the happiest man in the world, or I will feel disappointed. I matched and he told me, you don't have to stay in the clinic in the afternoon. You can go home, have fun. I was so relaxed and I felt happy. And 3 days later, I figured out I matched here at University of Washington. I was so lucky to come back because my wife and my kids, they live in SeaTac here. So coming back was like a reward, a best decision that I ever made. Although I get some over for BGY2 in New Jersey, but I was looking, coming back home will be the best decision and do 1 more year intern, which I did last year. And luckily, I was selected to be at Medicine Residency Advisory Council, what we call it MRAC, where I work closely with the Associated Program Director in order to improve the program and adjust our curriculum.
Wow, that's a remarkable story. The question I have for you is someone who has been the top of his class his entire life, being the very top in Somalia, going to a country that you don't even speak the language in Sudan, and then becoming the top of the class there. How did you adjust to being rejected from residency? How did you deal with that?
It was really tough. And as I told you, I have a lot of friends who started with me the journey and now they just give up because it is really very disappointing and it's really very tough. When you apply 100 to 200 program, that means we're talking about 6,000 to 7,000 every year, and you get 0 interview. That's really, is gut-wrenching and it is really disappointing. And the only thing that pushes me to come back again and again, it was my wife. She was always helping me. She always tells me that you will succeed one day. There is a light at the end of the tunnel. Just keep pushing, keep pushing. And in my nature, for give up, it's not in my dictionary. Always I will try. That's why now I'm trying to apply cardiology, which is another competitive specialty. But for give up, it's not in my dictionary.
What advice do you have, either for foreign medical grads or anyone who's pre-health or pre-medicine, who has dealt with disappointment or feels like things might not work out?
Always remember 3 things. Never give up, never give up, never give up. I know sometimes life has a lot of ups and downs, has a lot of challenges. We as a human being, the people who succeed is the people who have multiple attempts. Those people will succeed definitely. If you don't try, you will never gonna succeed. So always try to push yourself to the up limit. Try come up with another idea, with a different idea. If you try this year this way and it did not work, don't repeat the same because you will get the same result. You have to try to different way maneuver. I was applying residency blindly and I was getting rejected. I adjusted the way I apply. I added something new, which was having step 3 before even I started residency. Normally, step 3, they will take during the residency. So me doing before the residency, I'm showing the program I have a commitment. I'm not coming to play around. Me moving all the way to the East Coast, which I have 0 Somali connection, which I don't know anyone. That means it shows you that you have to get out from your comfort zone and do something differently. Then the result will show up.
And it sounds like when you were faced with this rejection, I think there was probably a big emotional component, but you were very analytical about it and said, these are the things that the feedback that I got, and these are the things that I can do.
Absolutely. I was so lucky that I had good mentorship. I had family support, and even the people who give me rejection, I always thankful for them and ask them a feedback. What can I do different next year to improve my chances? And I had good feedbacks from those program directors telling me doing step 3, it's helpful, doing externship, adjusting my personal statement. In my last cycle of application, I spent almost $500 just to adjust my personal statement.
Can you talk about the mentorship, or are there any mentors that stuck out in your mind throughout your long journey?
As I mentioned, I have a good connection with my old teachers back home, Somalia. And sometimes once I have issue, I always call them for advice. So they always tell me, you are at United States, the land of freedom. If you cannot succeed in USA, you will never gonna succeed anywhere else in the world. So that always pushes me to the limit that there is no excuse. Wake up, do your best, and trying to improve yourself one step at a time. That's really helpful. A journey of 1,000 miles starts with one step. So always try to do something different, something new, make a good connection. In USA, I always tell the people, we don't have corruption, but we have a connection. You want to have a good connection with the people who make the decision. You want to have a good connection with the people who are working in the hospital, in the program. So that's why I do a lot of advocate right now with Washington International Medical Graduate. I do hourly meeting every Thursday from 5 p.m. to 6 p.m. virtually. I meet with 20 to 30 international medical graduates for counseling. I give them feedback about their application, their personal statement, and that gives me I'm giving back to my community. I'm helping them. Sometimes I communicate with the program director, show them, hey, we have these people that live in our state, how we can support them, how we can help them. Now we have an ongoing conversation with the Department of Medicine in order to get externship for IMG who live in Washington state. And we get a lot of positive feedback so far.
Wow, that's incredible.
Absolutely. Having externship at the University of Washington, that's like a life-changing decision. And hopefully our goal is to start that program by next year, 2025.
How has residency been?
Residency, as I always tell, it is ups and downs. Inpatient stuff, outpatient is cool. Monday, Friday, you have weekends off. But once you are inpatient, doing MICU, sometimes it might get tough. You do like 70 to 80 hours a week sometimes. So I always say, it's dependent on which rotation you're doing.
How has your experience been in continuity clinic?
IMC, I always call is like home when you meet with people from your own color, from your own people coming as an patient. It has a unique feeling and unique connection and attachment. I'm so lucky that I end up in IMC and meeting with people like you, Dr. Molnar, and all the attendants, Dr. Genji, that are more open to help us, that give us feedback how to improve ourselves. Having the culture mediator, having the MA, having the pharmacy, all in one side, that's like, a gift from the God.
What's next for you?
Next for me, I am doing 3 projects of cardiology. One of them, I need to travel to Nairobi, Naivasha, where I am doing a training of echo stimulator in order to early detect rheumatic heart disease, mitral valve pathology, and enroll prophylaxis penicillin. So I have been working this project with Dr. James Kirkpatrick and Dr. Sheehan. And I have a couple other cardiology projects. I have been to American College Cardiology this year in Atlanta, and I'm hopefully going next year in Chicago. I submitted almost 4 to 5 cases.
And then the big goal is to go into a cardiology fellowship?
Yep. That's my big goal, to do more preventive cardiology and early diagnosis.
Well, thank you so much for your time. I think one big thing that I took away from this is how many things you're involved with giving back to people who are in the same situation as you are as a foreign medical graduate. I know that you've been mentioning them to me for a long time, but I think maybe we can talk more seriously about how we can support the work that you're doing, getting the word out about these different programs.
Absolutely. And thank you so much for having me. It was a pleasure to be in Ethnomed today. I'm a big fan and a big supporter of Ethnomed and what you do for our community. So thank you so much.
Thank you for your time. And now let's go rush to clinic.
Yep.
We hope today's episode has given you a glimpse into the determination and resilience it takes for international medical graduates to find their place in the U.S. healthcare system. Dr. Abdifitah Mohamed's journey began in Somalia, where the loss of a loved one sparked his calling to medicine. From there, he pursued medical school in Sudan, advanced his training in Kenya, and, after years of persistence and multiple attempts, finally secured a residency position in the United States. Today, as an internal medicine resident at the University of Washington, he carries with him not only his medical skills, but also the lived experience of perseverance, sacrifice, and hope. His story reminds us of the complex histories and global paths behind all international medical graduates in the U.S. Here's a preview from J.J. Bola, medical health social worker and poet, our guest on the next episode of Provider Pulse.
The kind of expectation then was that you study psychology and then you go on to do your doctorate, become a psychologist, etc. But I knew that for me that didn't necessarily feel right. I knew that there was more. I was passionate about psychology and about mental health, but I knew that there was a different path that I felt like I had to take, but I didn't know what. It's not going to come to you easy. Like, whatever you're passionate about, whatever you want to do in the world, everything takes so much challenge and so many obstacles to overcome. And a part of it is a test for you to be sure that this is what you're really passionate about.
Thank you for listening. If you enjoyed today's podcast, please share it with a friend. Word of mouth is essential for us to reach new listeners. Be sure to visit our website at ethnomed.org for additional resources. Also follow us on YouTube and Instagram at ethnomedUW and on LinkedIn. Do you have comments or suggestions? We would love to hear from you at ethnomedUW@uw.edu. Thank you.